Today on New Medication, we'll be looking at the drug Tamsulosin. Tamsulosin is a medicine used for men with enlarged prostates in benign prostatic hyperplasia. It is used to help them to urinate more easily. It relaxes the muscle around the prostate and the bladder neck to improve urine flow. It does not shrink the prostate. It only helps with the symptoms. Tamsulosin is a selective alpha-1 adrenergic receptor blocker, primarily used to treat benign prostatic hyperplasia, that's BPH. It relaxes smooth muscle in the prostate and bladder neck, improving urine flow and reducing symptoms of urinary obstruction. So mechanism of action basically is that tamsulosin selectively antagonizes alpha-1 adrenergic receptors, and these alpha-1 adrenergic receptors are predominantly located in the prostate, the bladder neck, and the urethra. So by blocking these receptors, it causes relaxation of smooth muscle tissue, decreasing resistance to urinary flow, and elevating symptoms of benign prostatic hyperplasia. So indications for tamsulosin: it is primarily used in treatment of benign prostatic hyperplasia. So when there's difficulty starting urination, when there's weak urine stream, when there's frequent urination, especially at night, or there's feeling of incomplete bladder emptying, the person have just finished urinating but then he feels that his bladder, there's still something inside. Give tamsulosin in order to improve urinary flow and reduce symptoms. For off-label use, it is used for other adrenergic related conditions, but primarily it is approved for benign prostatic hyperplasia. Dosage typically 0.4 mg, approximately 30 minutes after a meal. Dosage adjustment is done based on clinical response and tolerability. Now, use in caution with persons with severe hepatic impairment. Side effects include the common ones include dizziness, orthostatic hypotension, headache, nasal congestion, abnormal ejaculation. Abnormal ejaculation, maybe there's less semen or dry orgasm, back pain. For serious side effects, you have floppy iris syndrome during ocular surgery, priapism, hypotension, or allergic reactions. Less common side effects include fatigue, vertigo, and edema. So what are the advice for pharmacists? You counsel them as you are giving them the drug. You ask them to take it after food so that it can decrease the orthostatic effect. You monitor for hypertension, especially in elderly patients or those on antihypertensive. You educate the patient about the side effect, especially the floppy iris syndrome we talked about earlier in the side effects. You review their drug for drug interaction, and then you assess for any contraindication. If you find this information helpful, don't forget to give this video a thumbs up, share with your pharmacy circle, and subscribe for more clinical gems right here on Pharma Pro Mastery Hub, where pharmacy meets mastery. See you in the next episode.